So, welcome to Cholangio-Hepatocellular Carcinoma Canada's webinar on nutrition with Jessica Andersen, the registered dietitian. Her topic is nutrition and cancer, some general, some specific to cholangio-hepatocellular carcinoma. We've asked her this year to include some information on fatty liver disease because 1/4 of all Canadians have that. So Jessica, I've known Jessica for, oh gosh, 6 years, I think, 6 or 7 years now. And I worked with her at the Red Deer Regional Hospital. She was a dietitian on our unit. And so she graciously agreed to do the talk for us. So Jessica.
Hi, everyone. I don't know if any of you were here for last year's presentation or not. There are some things that we've kept from last year's presentation. We've added a few things, we've taken a few things out. So welcome and let's get started. If you have any questions, I think last year they got popped into a chat and we talked about them afterwards, or otherwise, if you just want to write them down and we'll talk about them at the end, absolutely. And then if there's any information that I don't have for you now, there's going to be a newsletter coming out, I believe June 11th. So if you have any questions that come up at that point, or that I'm unable to answer right now, I'm happy to try and address those at that time as well. So let's have a brief overview. We will discuss what nutrition can do for you and what it can't do for you, trying to set up some realistic expectations. We'll talk about managing nutrition impacting side effects that can stem from the treatment or your cancer itself. We'll touch on foods to avoid, if any, and a bit about fatty liver and how your cancer might be impacting your nutritional status. We'll touch on what to do or expect if you're admitted to hospital and where to go to get some assistance with your nutrition. I strongly encourage you to seek out nutrition advice that is customized to your situation and to be your own advocate to get a dietitian involved in your own care. So let's start off with a little bit about who I am, why I'm doing this presentation for you today. So I'm Jessica Andersen. I've been a practicing dietitian for coming up on 9 years now. Apparently I didn't update that in my slides. Oh, well, 8 years, I do have that in there. So I got my undergrad from the University of Alberta and completed my dietetic internship in Calgary. For those who don't know, the dietetic internship is a requirement in Canada to become a dietitian, and it's a full 11 months of full-time work with different dietitians in different areas, and it helps us train in the real world. So in addition to a 4-year degree that specializes in human nutrition, a dietitian also has an almost extra full year of practical training as well. I was extremely lucky during my internship in Calgary. I had excellent preceptors through that entire experience. I spent the majority of my clinical rotations working at Foothills Medical Center, which is where I met Rebecca Holmes. I did a rotation with her. She was one of my preceptors. After I finished internship, I also became a casual working at the Foothills Medical Center. So I got the opportunity to be trained and also work with Rebecca. So I learned so much from her every single day that I worked with her. She was a really good, big wealth of knowledge. As you know, Rebecca passed from cholangiocarcinoma a few years ago. Before Rebecca got sick, I moved from Calgary to Red Deer for a position working at the Red Deer Regional Hospital, which is where I started working with Brenda, who is Rebecca's mom. We were colleagues and working on the same unit in Red Deer as Brenda was saying earlier. So as someone who's worked with both Brenda and Rebecca, I can say that this is a very caring, loving family who prizes evidence and research and helping others over all else. I was honored to be asked to put on this presentation for all of you as a former student of Rebecca. So let's talk about what nutrition can reasonably do for you. When starting out after a diagnosis, it can be hard to think about what kinds of things to prioritize and focus on. Nutrition should always be a priority in your life, whether you're going through a cancer journey or not. The reasons for this are many, but perhaps the most important one is proper nutrition can improve your quality of life. Before, during, and after treatment, if your nutritional status can be maintained, you'll move through these transitions a lot easier. You will have more energy and maintain your muscle mass. If your muscle mass can be maintained, not only will you be more functional, by which I mean you're able to do more things for yourself, but if your muscle mass can be maintained, you're less likely to have adverse effects from your treatment as well. If your nutrition status is poor, you run the risk of nutrient deficiencies. If you develop deficiencies of any micronutrients, such as vitamins or minerals, or even macronutrients, carbohydrate, protein, or fat, you'll have a harder time healing and getting better until these things are directly addressed. Proper nutrition can help manage other chronic diseases as well, such as diabetes or celiac disease. If these are properly handled, this will make your treatment a lot less difficult. If nutrition can also be a priority, this will help make malnutrition a less likely outcome before, during, and after your treatment. And then let's talk about what nutrition can't do for you, because nutrition, just like anything, obviously has limitations. So no matter what someone tells you online, nutrition does not replace medicine. We obviously need medications. If we could get by on nutrition alone, we would. But for example, nutrition isn't going to help you if you are in pain. It's not a pain medication. It can't bring down an extremely high blood pressure. It isn't an antibiotic if you have an infection. It can't replace medicine. You can't out-eat your need for potentially needing medications. Medications are important and necessary. Nutrition also can't change your genes. No matter how much we try, you can't change your genes. Some types of cancer have a very heavy genetic component. It doesn't mean that diet and lifestyle and those kinds of things aren't still important. Of course they can. They can decrease how severe an illness may be. They can also help you delay the onset of some diseases, but genetics overall can't be changed by nutrition or healthy lifestyle. You can't healthy lifestyle your way out of the possibility of genetic risk factors. As well, I'm sure that you've seen fad diets or other things claiming that they can cure or shrink or stop cancer from spreading. Nutrition cannot stop or cure any type of cancer. And if you see anyone online who's saying that they have an extremely restrictive diet that will cure your cancer, if it sounds super complicated and too good to be true, it probably is. It's probably not a good person to be getting your nutrition advice from. So there's common forms of cancer treatment, just so we can kind of touch base on certain things that might impact your nutrition status. So chemotherapy, radiation, immunotherapy, and surgery are common treatment types. All carry possible side effects that could make getting proper nutrition difficult. There are also some newer targeted therapies that are emerging at this time. Because I haven't really seen a lot of these, nutrition-related side effects aren't very well known to me. But as time goes on, and we might be seeing them in practice in the hospital, I will learn more about these kinds of things. So there are many different possible nutrition-related side effects of treatment or the cancer itself. This is not an exhaustive list, but these are some very common side effects that might negatively impact your oral intake. The side effects include nausea and vomiting, diarrhea or dehydration, poor appetite, sometimes referred to as anorexia, rapid weight loss, and we'll touch briefly on a term that you may hear, which is cancer cachexia. Other possible concerns are taste and smell changes, dry mouth, mouth sores, and fatigue. I won't get too in-depth this year onto most of these side effects. These are available in last year's presentation, which is recorded and on the website. However, if you're struggling with any of these side effects, do make sure that you are talking to your healthcare team and asking how you can improve these side effects or manage them properly. And it's a really good idea to maybe get a referral to a dietitian who can help you with your specific concerns. But today I was going to touch still on poor appetite, rapid weight loss, and cancer cachexia. Poor appetite is a very common side effect of many types of illnesses. Unfortunately, there's no magic bullet medication-wise for poor appetite, although there are a few that we are seeing emerge. I'm actually trying for the first time myself at the hospital cyproheptadine for increasing appetite. So fingers crossed that that works out. We'll see how that goes. Most medications are used kind of off-label if they're trying to increase appetite, so they often have a lot of other side effects. So sometimes that's not the best way to go, unfortunately. There are all kinds of factors that can impact your appetite, obviously. So treatment, your cancer, your mood are all very common ones. If other symptoms are contributing to poor appetite, such as nausea or pain, try to manage these first directly through your doctor, and that can sometimes help with your appetite. Speak to your support system or your doctor if your mood is low or your emotions feel like they are contributing to your poor appetite. Consider eating smaller amounts more frequently. This will help you get in more in a day rather than just having 3 poor small meals a day. When your appetite is poor, focus on protein and calorie dense foods when you are feeling up to eating. Basically, try and get the most bang for your buck when you are feeling up to eating. Consider supplementing your solid food intake with nutrition supplements such as Ensure or Boost or other brands. The type doesn't really matter. It's often easier for you to drink your calories than eat them when your appetite is low, and that's just going to help maintain, hopefully, that muscle mass. Some people find that their weight is very difficult to maintain no matter how hard they try. They find that they're eating relatively the same amount as they were before, volume-wise, calorie-wise, and yet they're finding that their weight has continued to drop. If you're battling any other side effects, rapid weight loss can also be more pronounced. So if you have, again, other things going on like nausea, that could make the weight loss more pronounced as time goes on. It's important to be on top of your weight in order to be proactive. Monitor your weight trends. If consistently declining, action should be taken. And I'm not saying weigh yourself every single day. Usually I would recommend weighing about once a week, write it on the calendar, put it in your phone, up a little, down a little, normal, down, down, down. That's a concern. We need to be looking into that a little bit more. Your needs for calories and protein may be higher than usual. When the body is fighting to get better and healing, calorie and protein needs can be higher than they used to be. Increase what you eat in a day if you're able to, and prioritize calorie-dense items, again, considering supplements to meet those higher needs because it can be easier to get in calorie-rich liquid than to eat high volumes of solid foods. Some people just don't tolerate that very well. And it's just an easy way to get a little extra. If you're struggling with the ambiguity of when someone's just telling you to get more without any specifics, you could ask for something like indirect calorimetry, which would give you some tangible answers about how many calories potentially your body might need. Indirect calorimetry measures your metabolic rate by measuring oxygen in, CO2 out when you're breathing at rest. And it gives you an indirect estimation of your resting metabolic rate, and then you need calories above and beyond that in order to maintain your weight. Or ideally, maybe even add some weight back on. This is linked to your muscle mass, so if you've already had a very large weight loss, indirect calorimetry might not give you the exact answers that you're looking for. So that's just something to keep in mind. So if you're starting to see weight loss, earlier might give you a better reading. As well, your dietitian should be able to tell you where to get something like indirect calorimetry done. However, some places you might have to pay for it. So that's just something to keep in mind. So cancer cachexia is a special term to refer to rapid, unintentional weight loss that can occur in cancer that's not just simple weight loss, but driven by inflammation and metabolic alteration. So truly, it's at this time, there's still a lot that's unknown about cachexia, but it's not just regular weight loss. It can preferentially increase loss of muscle over other types of tissue. Loss of muscle can lead to limitations in treatment, as muscle generally is what helps with metabolism of drugs. Loss of too much muscle could lead to bad drug reactions, which could lead to pauses in your treatment. Cachexia can lead to anorexia, fatigue, fat and muscle wasting. Nutrition support such as tube feeding could help manage cachexia, but even this requires additional research, as cachexia is more than just calories in or overcoming a calorie deficit. Increasing calories does not always lead to increased weight in cachexia, but it should usually help you at least stabilize your weight. So moving on to what a lot of people have on their minds, I'm sure, what foods should I avoid? Generally, we want to be as least restrictive as possible. So in short, almost nothing needs to be restricted across the board. There's almost nothing that we say, whether you're undergoing treatment, prior to treatment, post-treatment, that we say you absolutely should not have. The small exception would be alcohol, as it often doesn't play very well with other medications. and processed meats because they're high in saturated fat and sodium content, and this often isn't well tolerated as well. These are the two foods that have a direct link to cancers, specifically GI cancers. There is convincing evidence that both of these are, if taken in high amounts, directly contribute to the possibility of developing cancer down the line. So those are our two that we say, hey, if you're looking for something to avoid, those are the ones. Some individual restrictions may apply based on your treatment. Your doctor or pharmacist may recommend a restriction. For example, some chemotherapies require a limitation of citrus fruit. Otherwise, you're free to eat what you like and encouraged to eat a variety of foods to ensure that intake of adequate calories, vitamins, and minerals. As well, enjoyment of your food is extremely important for your mood and your overall well-being. So we do recommend eating a lot of things, different things, and not restricting. One that we get a lot is, what about sugar? Can I eat sugar? Do I have to stop all carbohydrates? Doesn't sugar feed cancer? The answer to that is no. And obviously, I'm not saying live off of sugary foods. We can definitely still consider decreasing the amount of straight sugar that you're getting in your diet. We are looking to usually minimize that amount. They do say like 10% of your calories in a day coming from sugar is kind of what we're looking for, but we're not saying cut it out. We're not saying you can never have it. We're not saying that it is going to feed your cancer or make it grow faster or anything like that, or that carbohydrates themselves are bad. Your brain loves carbohydrates. It's still important to keep you strong and getting adequate calories, so carbohydrates are still something to have. We're also trying to make sure that you're going to have good mental health and some semblance of normalcy. If there's a reason to celebrate, like a birthday or a wedding, those often come with things like cake. Have some of the cake. That's still important for you to be doing, okay? We're not saying restrict sugar or carbohydrates. You don't need to do that. The best way to keep yourself strong is to eat a varied diet, and that can include sugar. The same idea of not being restrictive goes for other fad cancer diets, not being too restrictive, such as the alkaline diet or intermittent fasting. I'm sure you've heard of some of these as well. There's not enough evidence to recommend these, again, across the board, and they run a high risk of being too restrictive and putting you at risk of weight and muscle loss, which could negatively impact your quality of life or your treatment options. So inflammation, especially long-term or chronic inflammation, has been a source of interest in cancer research for a long time. There have been questions about whether diet can contribute to causing or can help with managing inflammation in the body. As stated on one of our previous slides, excessive intake of alcohol or processed meats can contribute to inflammation and are proven to contribute directly to cancer risk. There is some evidence that a diet high in ultra-processed foods may increase your risk of inflammation or your risk of chronic disease, but there's no one specific food to pinpoint as a reason that cancer may develop generally. So, for example, I can't say never eat Cheetos again, right? Because we can't pinpoint a single particular food. There is some evidence there is some evidence that a diet high in fruits and vegetables, whole grains, and including sources of omega-3 fats, such as fish, may help control inflammation when done with other lifestyle changes, such as exercise. There's no one single dietary pattern that we recommend, but following a Mediterranean-style diet or a DASH-style diet, or the healthy plate model, which the latest Candidate's Food Guide is modeled after, are all appropriate dietary patterns to follow most of the time that can potentially help control inflammation and therefore hopefully decrease your risk of chronic disease and some cancers. So, how is my cancer impacting my nutrition? Because of the location of your cancer, your nutrition may be impacted as your absorption may be a concern due to obstruction of bile ducts or damage to your liver. Or if this is not the case now, it may be during treatment or post-surgery. The thing most difficult for you to absorb is going to be fat in your diet, although protein can also be impacted to an extent. If you're malabsorbing, you may experience abdominal pain, bloating, excessive gas, diarrhea, or fatty stools that are pale and hard to flush down and frothy, and eventually this could lead to weight loss. Fat is very calorie dense. Not absorbing fat from your diet will decrease the number of calories you take in quite considerably and start to impact your weight in what could be a very short period of time. Protein and carb do have some other ways of being absorbed to an extent, whereas fat does not. So it's kind of your number one indicator on if you're having difficulty with absorbing. If you're struggling to absorb your fat, pancreatic enzymes taken orally may help you absorb better. If this is the case, finding the right dose and adjusting your dose might take some time. As well, these enzymes would then need to be taken with all meals and all snacks moving forward to get appropriate nutrition and help minimize your symptoms as well. So a damaged liver does not function the same way as a healthy one does. As such, your liver might not be storing energy between meals like it used to. Rather than picking away at your reserves, by which I mean like your muscle mass, because if your body is fasted, it's going to start getting that nutrition from somewhere, we do recommend eating more often to help preserve your muscle rather than your body reverting to trying to break down your muscle to get some nutrition. So instead of letting your body reach a fasted state, we do recommend eating more often to avoid breaking down that muscle. So every 2 to 3 hours, looking to have something to eat so that your body isn't going, I don't have anything, and trying to break down that muscle as something for it to use for energy. As we discussed previously, fat especially may be difficult to absorb. As such, your fat-soluble vitamins A, D, E, and K might be difficult to have at appropriate levels, and some minerals like zinc, selenium, and copper might also be difficult for you to keep at adequate levels. Consider like a multivitamin, or you can have your doctor check these levels for adequacy, and then you can have more targeted repletion from there if something is low. Especially post-surgery, some patients may develop something called BAM, which is bile acid malabsorption, or SIBO, small intestine bacterial overgrowth. Both can be dismissed post-surgery as ongoing issues, post-surgical or IBS, if your surgical team isn't super well versed on these issues. Both present as like diarrhea, bloating, and cramping, and gas, and it could lead to nutritional deficiencies. So you could request a GI specialist to dive a little deeper into your concerns if you would like to look into that further. So this is the relatively new, and I say relatively new, I think it's been out for about 10 years, Canada's food guide. So as you can see, we have half the plate full of fruits and veggies. This is providing lots of vitamins, minerals, fiber, and antioxidants, all really good things. A quarter of your plate is going to be those protein sources, as well as your meat alternatives. Nuts and legumes are going to be there. Your dairy source is going to be under the protein portion as well. We have a low representation of red meat, and we're leaning towards leaner types of meat like fish and poultry for the most part. The last portion is a quarter of the plate is your whole wheat or brown versions of your grain products. Again, we're looking for these because they're higher in B vitamins rather than the white version, and they have more fiber, and they'll provide the carbohydrates that your brain craves. And as you can see, we're not seeing a lot of representation of like ultra-processed foods, super high in sugar foods. Again, not saying they don't fit into a diet, but these are the things to have less often rather than more often. This is the kind of dietary pattern we'd be looking for most of the time. So if I'm feeling well, how should I be eating? Generally, if you're feeling well, we would recommend a generally healthy diet. Fruits and veggies are nutrient dense and have antioxidants as well as polyphenols, which provide good nutrition to your body and help support your cells before, during, and after treatment. As well, they're very fiber rich. Fiber is an excellent way to keep your digestive tract as healthy as possible. We do see, especially in North America, people are not getting enough fiber, and it has been one potential reason that we've seen a rise in things like colorectal cancer. The average North American diet is too focused on meat, especially red meat. We recommend trying some non-meat protein sources, so like beans, peas, tofu, lentils in your diet, and aiming for 25% of your plate to be the protein instead of the closer to 50% that a lot of people have. We are looking to get more leaner types of meat as well. So like we're looking for poultry and omega-3 fats from fish, which we're looking to get fatty fish 2 to 3 times a week if you can. This decreases your risk of heart attack and stroke, which is very important because unfortunately people who have cancer have an increased risk of heart attack and stroke. So we're looking to minimize that risk as much as possible. And then that 25% of your diet should be whole grains. The whole grain version contains more B vitamins, more fiber. And as we stated before, fiber is very helpful for keeping your GI tract as healthy as possible and decreasing risk of GI cancers. So just a little piece about mood and nutrition. Mood and nutrition is an important thing to discuss because mental health can greatly impact how you're able to function. As we said before, eating well is hard enough during this journey, but something like mood can definitely impact your ability to eat well and feel well enough to even make food sometimes. So if you're having difficulty with things like your mood or how you're feeling, talk to your healthcare team. The mental load of getting a diagnosis, preparing for and undergoing treatment, and recovering can be a lot. If you find you have low mood or mood is impacting your ability to eat or do things you usually enjoy, talk to your healthcare team. There are resources and support available, as well as medications that can help improve how you're currently feeling. So this year there was a request to talk a little bit about fatty liver. And as Brenda was saying, fatty liver is quite prevalent. It impacts about 25% of Canadians. MASLD stands for metabolic associated steatotic liver disease, and is when you have excess fat stored in the liver. This can lead to inflammation and damage to the liver, and if allowed to progress, can lead to MASH, which is metabolic associated steatohepatitis. Ongoing, this can lead to liver fibrosis, which is scarring of the liver, which can lead to liver cirrhosis, which is severe scarring of the liver to the point at which the liver is changing shape and no longer working appropriately. This in turn could lead potentially to liver cancer. Now, it's worth noting that not everyone with fatty liver progresses along these timelines. However, if you're aware of having fatty liver or it runs in your family, it's important to take action to avoid damage to the liver and possibly progressing to the point where your liver is quite damaged. So, what can I do about fatty liver? Ask your doctor if you're at risk. You are at increased risk if you carry extra weight, have diabetes, high blood pressure, high triglyceride levels, have had bariatric surgery, or lost a lot of weight in a short period of time, or have a genetic predisposition, which is a very long-winded way of saying just about anybody is at risk. Pretty much everyone carries a potential risk for fatty liver. So what you can do is ask your doctor to perform a blood test to check your liver enzymes. If these come back abnormal, it's reasonable to then move on to ask for an ultrasound or a fibroscan to assess if your liver may have abnormal fat storage. The good news is, if you have MASLD, diet and lifestyle changes are possible to improve or reverse this. There are at this time no drugs available on the market for this, but there are some in development, so you can stay tuned on that. If you've recently been told that you have fatty liver, there are some diet and lifestyle changes you can make to improve your condition or even reverse it, keeping in mind that there is no cure. So these changes are something that are recommended to be ongoing long-term to help manage your condition. First and foremost, get active. Find a form of physical activity you enjoy and try to be consistent with it. If you're able to work some form of physical activity into your daily life, this will be best, but most importantly is to just start and get moving. Take your medications as directed. For example, if you've been prescribed medications for diabetes or for lowering your cholesterol, take them as prescribed. As well, take over-the-counter medications, sorry, as prescribed as well. And if you're taking any unregulated supplements, it might be good to check with your doctor, as some of these can actually cause liver damage. Eating a balanced diet is important. Again, you guys are going to be tired of me saying this, but a Mediterranean style diet can be quite appropriate for treating fatty liver, as well as that healthy plate model that we had touched on earlier. If you drink alcohol, limit or stop. And lastly would be managing your weight. If you've done some of the above lifestyle changes, it's likely that you may have seen some changes in your weight already. If you're actively gaining weight, trying to stabilize your weight would be your first goal. If your weight has been stable, potentially a small amount of weight loss would be helpful with managing your fatty liver, and trying to be reasonable with that. So we're talking like 5 to 10% of your body weight. Some people are like, if I don't lose 100 pounds, it doesn't matter. Absolutely not. 5 to 10% can be helpful. So let's talk a little bit about what to do if you get admitted to hospital. So there's a good chance at some point you may be admitted to hospital during this journey. I would highly encourage you to ask for a dietitian consult. Even if you haven't lost a lot of weight and you're eating well at this point, you're at high nutrition risk. Early interventions are very helpful for making sure that you're going to have a shorter length of stay in the hospital, as well as, like we said, being proactive, and on top of, if you are seeing weight loss, getting those interventions in place as quickly as possible, as well as helping you for symptom management. So a dietitian can continue to assess you during your stay and recommend changing the way you receive your nutrition if necessary. So including things like tube feeding or IV nutrition if necessary. It's extremely important if your treatment plan includes surgery to make sure that you're well nourished for proper healing. So who do I talk to outside of the hospital? If you're looking to get started right away and you're not admitted to hospital, your cancer clinic will have a dietitian you can access to work with you during your treatment or the lead up to this. If you're not pursuing treatment or treatment has not started or completed, you can also get the assistance on your nutrition from someone like the home care dietitian, as well as someone like a primary care network dietitian, or your hospital should have a general outpatient dietitian who would also be appropriate in providing you some assistance or guidance. So our general takeaway messages for today is nutrition is important prior to treatment, during treatment, and for proper healing after treatment. It's also important for things like your quality of life, even if you're not going to be pursuing treatment. So it's important for everybody. Throughout your journey, there's likely to be times you'll have a hard time getting adequate nutrition, whether due to your cancer or your treatments or how you're feeling about the situation. Whatever your concern is, ask for help from your healthcare team and your loved ones. It's very important to get help when you need it. If you have symptoms, whether that's nausea, diarrhea, whatever, actively pursue improvement of these side effects. There's approved treatments that you can pursue for any of these symptoms that you may be having. Don't suffer. Ask what can be done, and if things are not managed adequately, continue to go back to your healthcare team. A healthy diet is made up of variety. Eat many different foods and switch things up to ensure that you will enjoy your food and ensure you're getting adequate vitamins and minerals. So we can open things up to questions. We do have some recommended resources. Most of these are the same as last year. I did add the Liver Canada as well, and some references if you're looking to follow up on any of those. But let's jump to, are there questions?
Put your questions in the chat box if that's okay. There's one here that says, this has been very helpful. Many thanks. Need to head to bed. Okay, thank you.
Sleep is a very important thing. And also, if there's questions that come up later, they can also be addressed in this coming month's newsletter as well.
You just have to write us, and we'll give the message to Jessica, the question to Jessica, and she will answer your question for you. And Jessica, did you want to mention that book, that nutrition book that the University of Alberta professors wrote?
Yeah, so actually one of the girls that I went to university with developed a like cancer nutrition cookbook. So that's actually linked on the website. So have a look at that if you're looking for different different recipes that you could use that are going to have some good protein for you, calorie dense, those kinds of things.
And then there's another many thanks for your time and information. Yeah, so in the chat, we put in last year's, the URL for last year's YouTube video presentation, and then also the high protein cookbook link is in there as well. It's a free download. You can just download it for free. So if there's no other questions, thank you so much, Jessica, for sharing
Oh,
your
there is a
expertise with
question.
us. Oh, I
Can
have a
you be
question.
more specific regarding processed meats? So we're talking like cured meats and those kinds of things. So we're talking about things like bacon, lunch meats. We're looking to have less of those in our diet. Does that make sense? Yeah.
Thinking like
Any
salami, that's kind of thing. Salami and
Yeah. So some of those really good ones, unfortunately. We're not saying never have them, but not something to have very often and not something to be like a staple in your diet if we can avoid those.
and how does the Mediterranean diet differ from the healthy plate model?
So they're not too terribly different, to be totally honest. Um, where we see like a Mediterranean diet is a little bit different because, like, again, the healthy plate model was developed more for like a westernized um, audience where we really like our meat. We find that things like a Mediterranean diet, they're going to be using some non-meat alternatives for their protein on a more regular basis. So that's a good thing to kind of be getting more of in your diet. Other things that they use very often is things like olive oil, which again has kind of become a little more mainstream in a Western style diet. But those are the kinds of things that they would be using for their like fat and in cooking and those kinds of things. So that would be something to be getting more of in your diet as well if you're looking for a more Mediterranean style, but they are fairly similar. Otherwise, we're still looking for more fruits and veggies and high fiber. What about sliced ham and chicken? Ham would be again because it's cured. That would be something to have a little bit less of. It would still probably fall under like processed. Fresh chicken wouldn't fall under that, but like if we're talking about again kind of like a cured chicken, like I think there's some like lunch meat type style chickens that might not be our best option, but a fresher meat would be fine for the chicken. And again, we're not saying never have ham. That's okay. You can have it sometimes. If especially if we're talking like we said, some people are like, we have ham every Christmas. Have your ham at Christmas. That's okay. Sorry, that's my dog. She's saying she's starting to whine at me. It's okay, Gritty. Any other
Anybody
questions?
else have any questions? Oh,
An acquaintance today was selling us about the importance of albumin. When we're saying albumin, are we talking about albumin like because albumin is in your blood. It's one of your it's a protein that your body is producing. They used to use albumin as a they used to use it as like a proxy of your nutrition status, and it's actually a very poor indicator of that because it's a negative acute phase reactant, which is a fancy way of saying if your body is inflamed, which if you have cancer or are undergoing treatment, it's going to be, unfortunately. If you're fighting off an infection or you are, septic in any way, your albumin is going to be low. So some people, especially, unfortunately, doctors still often be like, hey, your albumin is low. This is an indication that you're malnourished. and not necessarily. I mean, especially if you're fighting cancer, there's a good possibility that you are malnourished, but it's not a good indicator, and we don't recommend it as an indicator of malnutrition because there's so many other things that can impact it. And we don't necessarily like albumin isn't something that you would like eat or as part of your diet. Although if your albumin were to get very low, they can give you an albumin infusion in hospital. So that is an option. And the reason they would do that is if your albumin is very low, you start to get puffy, you hold on to fluid. You do something called third spacing. That's why they might be monitoring it and concerned about it, and you might end up with an infusion. Does that answer that question? So like albumin is important overall, but it's not a good indicator of your nutritional status like they used to think it was, because so many other things impact it.
Are there any other questions? Just watching the chat for a few seconds more.
And if there's more stuff, send it to Brenda. We can include it on next month's newsletter, June 11th, I think.
Yeah, around middle of the month. So anywhere after June 11th to the 15th. So Jessica writes the Ask the Dietitian column in our newsletter twice a year, every June and every December. So if you have questions, then you just send them to us, and then she answers them and answers all the questions that you have. And if you have them in between as well, you can always contact us and we'll ask Jessica. She's really good about answering those questions. So your love for dietetics is obvious. And so thank you very much for sharing your expertise with us tonight. And we appreciate the information on fatty liver disease too. June the 11th, it's actually Global Fatty Liver Disease. One more question in the world. So everything's going to light up green then. One more question is canned soup.
Are we saying canned soup good or bad? Is that the question?
Yeah.
I mean, it's high in sodium, but you can get some that have some good fiber. You can get some that have some good protein. Overall, I would still say mostly good. I'm not saying live off of it. But yeah, it can definitely be part of a healthy diet. Canned soup with maybe you have some veggies on the side. No problems there. Everything is part of a healthy diet. But yeah, even if you like make your own soup, which can be tough, but you can make some and freeze it so you have it for different times when you're maybe not feeling able or up to making stuff, but then you can throw in some lentils or other things to increase the fiber and protein. You've got all kinds of options, but you could still really do that with canned as well. You could mix in another can of lentils with it, for example, or some beans to again kind of fit that potentially more Mediterranean style. There's so many things you can do. Okay.
I think those are all the questions. Is that correct? Looks like it. But you could please just email me and I will pass the message on to Jessica and she can put the answer in the newsletter as well. So thank you so much, Jessica. Really, really appreciate your time and your expertise.
Yeah. Thanks.
Yeah. Thanks.